Hello everyone. Today we are going to talk about thyroid cancer. Have you ever felt a lump in the front of your neck? Have you undergone radiotherapy before? Well, today's topic will be about dangerous cancer, which is thyroid cancer. There are different types of thyroid cancer. Age, gender, and being exposed to radiation can affect the risk of thyroid cancer. After watching this video, you will know everything related to thyroid cancer, its risk factors, symptoms, and how to diagnose and treat it. Our role today is to answer most of your questions regarding thyroid cancer. Today we have Doctor Yoon, who is leading doctor at St. Peter's Hospital. He's going to discuss with us everything about thyroid cancer from an experienced medical point of view. I am Ume. Before we start, please subscribe to our channel so the next time you will be updated with our new releases. Good afternoon, Dr. Yoon.
Yes, thank you for visiting my hospital.
My pleasure.
Yes.
Okay. Can you please introduce yourself just briefly?
My name is Yoon, and I'm the director of this hospital. So my majority is, endocrine surgeon, and you know that especially in thyroid treatment, I did that one for my life, and I'm just international Society of Oncoplastic Endocrine Surgery. I'm the first one who, developed, conference. And now I did that one. And my job is to the thyroid surgery and the thyroid treatment.
Okay, perfect. So, starting from the first question, what is exactly thyroid cancer?
So thyroid cancer means that in thyroid gland is just middle of the anterior neck. It says usually the size of the thyroid is 20 or 30 grams, and it's sized in directly from the top and down is 4.5 or 5 centimeters. Depend on is quite different from the female or males. And there's thyroid cancer is the malignancy from the thyroid gland. It's very popular in Korea, especially in female, and in the male patient is one of the top cancer found in Korea nowadays.
Okay, so somebody who has thyroid cancer, does it have any symptoms?
And long time ago, that means that 50 years ago, it's very simple to get the thyroid cancer usually by palpation. Means that when you treat the patient, we examine the patient using their fingers. But nowadays, we have many tools to examine the patient, like thyroid sono and PET scan or some CT scan we did. So by doing that, it's very easy to diagnose thyroid cancer or thyroid tumor or thyroid disease.
So what are the common causes for thyroid cancer?
So actually, we tried to get the causes of thyroid cancer. The purpose of to try to get the causes of thyroid cancer is that know that the causes we can treat the patient is effectively. Yeah. But still, so far, we don't have any clue about that one, except the radiations during the young childhood. As you know, that in Chernobyl and Fukushima, radiation injury. And in adult people, so we don't have any clue to get thyroid cancer. That means that we cannot find any instance of adult thyroid cancer. But after the Second World War II in the United States, it's very easy to it's very popular to get some radiation to the in tonsillitis and in a young child. So, but that causes of thyroid cancer. But so far, we don't know exactly what is the cause of thyroid cancer nowadays.
So, if you don't really know the causes, for example, if somebody has it in the history of the family, does it really affect the likelihood of it happening?
Yeah, we try to get some relationship or genetics found the chromosomal study between the generations of families, and But in my hospital, it's a former hospital in Seoul National University. We did that one, and during my stay in the United States, I stayed in Boston, as you know, Harvard Medical School. I did that one, and but so far we don't have any clue. But statistically, we can find that if the generation between the generation or father to or son or some mother to daughter and some between the daughters, if they have one generation, they have the same kind of thyroid cancer. Instance of the thyroid cancer is 10 times more than normal.
We talked before, as you mentioned before, about different method of diagnosis.
Yes.
Can you please elaborate more on those methods?
Yeah, the only way to get the thyroid cancer diagnosis is through the fine needle aspiration or some biopsies using that ultrasound. And beside that one, genetic and BRAF permutation, that one. And depend on the types of thyroid cancer, is quite a little difference. So my recommendation is that to get the thyroid cancer, when we suspected thyroid cancer, do the thyroid sono and using that fine needle aspirations or some biopsies. That is one perfect diagnosis of thyroid cancer.
So moving on to the treatments, what are the treatments available?
So, generally, we to treat the malignancy of thyroid cancer or some other malignancies, there is 3 ways, and it means that the 3 methods of them is, generally we told them is chemotherapy, as you know, secondly, and radiation therapy, and lastly, in surgical removal of that one. That is the standard 3 ways of malignancy treatment. But in as a chemotherapy and the radiation therapy is inefficiency in thyroid cancer. The only way you can do that in the surgical removal of a solid tumor thyroid cancer. There is only one way to treat the thyroid cancer.
So after the treatment, what is the follow-up of a thyroid cancer patient?
Yeah, so that I told you that in Korea and in the worldwide, thyroid cancer is the most popular, and especially in top lengths of cancer. And so many scientists and doctors, they try to get over the thyroid cancer treatment. And the only way we can do that, as I told you, that thyroid cancer is a surgical removal of solid tumor. After that, we did that one. But that we do not know the cause of thyroid cancer. So we do not know what is the prevent of this one. So after the founder of the thyroid cancer, the only way we can do that, removal and the follow-up study of thyroid tumor.
Okay. So how about the prognosis?
So actually the prognosis is very nice. And we call them, it's quite different in like in gastric cancer and breast cancer. And the prognosis factor is the size of the tumor. But inside of the cancer, the age, usually the age of the patient is very important and high, influential factor. So in the between that one, in the old ages is 45 years is standard ages, but nowadays 55 years old is that standard, and below the 45 or 55 is very good prognosis. That means the low risk patient, and above that 55 is a very poor patient, means that they are very easy to recur, even though and satisfied operation or some other method treatment.
Okay, perfect. So after thyroid surgery, is it necessary to take hormones or thyroid hormones?
And but actually, some patients, they worry about for the lifelong take the thyroid hormone. But nowadays, the standard treatment is quite a little different from the old ages, because nowadays, and just the limited surgery or some limited, treatment is tried. So by doing that, in case of just only one lobe, we have 2 lobes in thyroid, just one left on the right. Just one lobe is involved in thyroid cancer. Just one lobectomy we recommend. And but in case of bilateral total lobectomy, we have to get the thyroid hormone, because for the lifelong they have to get prolonged their life, very well. But in half of them, in hemilobectomy, just one lobe is removed. And sometimes we do not recommend the thyroid hormone. So don't worry about this hormone replacement.
So for this type of cancer, how often does it recur after full treatment?
So actually, if the patient is, as I told that we have 4 types of thyroid cancer in just mostly the 92% of the cancer is a papillary thyroid cancer, and secondly is that follicular thyroid cancer, and thirdly that's the medullary thyroid cancer, and very rare, but sometimes after changing of this papillary thyroid cancer, follicular cancer, with the age, growing the ages, they change the undifferentiated carcinoma. That means that if you diagnose the undifferentiated thyroid carcinoma, the death rate within 1 year is 90%, very dangerous. So that means that in papillary thyroid cancer or follicular cancer, medullary cancer, if you did the operation properly and completely, so we can expect a lifelong and good survivors.
Very good. So for partial thyroid removal, what are the advantages and disadvantages of this kind of operation?
Yes, you know that thyroid is very dangerous and in the middle of the neck, and when you phonation like vocals, and the nerve, recurrent laryngeal lobe, passes through the thyroid inside. So when you remove the ones, lobes, and even the thyroidectomy, it's very easy to injure that nerve. With the nerve, the injury is impossible to reversibly and injured, even though you connected a nerve. So it's very, and sometimes we did that nerve injury in unexperienced surgeons. So in surgery, just we use that experienced surgeon or unexperienced surgeon in case of silent surgery, use that terminology.
Okay. So there is a method for robotic thyroidectomy. It is called the bilateral axillo breast approach. Yes, that's how you. What is it? What is it about?
Before that, I explained the type of operation inside of the surgery, and we divide it in 2 ways. One is the scarless operation. That means that you cannot find any scar in outside. One is a scar operation. In one scar operations, we did that conventional types in anterior middle leg of 5 or 6 centimeters. And using that is old traditional around for 100 years. We did that one. And that divided in upper, middle, lower. I prefer the lower line skin incision, and with that one we cannot find any uncomfortable after the operation, and maybe I think not so many, just a limited number I did in my Seoul National University hospitals. I did that one, so my fellow doctors, they did that. And another one is now popularly they did axillary robotic system operation. So in some other hospital they did that, is in axillary area and 6 centimeters using the robotic systems. That is not scarless, because they remove that scar in midline to the axillary area. You understand me? Yes. And the third one is the post-auricular area, because the large incision scar, they want to hide through the hair. So in outside they cannot find any scar after the operation. But that is a big size, incision scar. And that is one type of scar operation, traditional and newly updated some robotic system. But I insist that another one is scarless thyroid surgery. One of them is a bilateral axillary breast approach, then BABA. We call them BABA. And before that, the scar in the body, we cannot differentiate the normal and the scar in oral mouth inside, and another one is the anus And another one is so nipple area in alveolar area. It's very easy to healing that one. There is one reason why we did that. Instead of midline scar, I did that 5 millimeters in alveolar, both and axillary wrinkles.
Yeah.
So we cannot differentiate in outside after operation. So using that, and the first times around 20 years ago, I did that one using that endoscopy. I developed that one. At that time, so no other method like the scarless operation. I did the first time in that, and doing that after that, and maybe I think as 15 years or 16 years ago, I adapted the robotic system, the Da Vinci system, as you know, the robotic surgery. I did. So by doing this, it's very easy for the patient and for the doctors. It's very easy because if you use that endoscopy or robotic system, the size of the thyroid inside or outside is magnified 15 times. So unbelievable, that. Even though small size, 1 centimeter, you can, is more than 10 centimeters and 3 dimension. So you can barely handling everything very completely. So even though you did not experience, not the unexperienced surgeons, you can differentiate it from nerve vessels from thyroid in others. That is one of the BABA procedures I did. So nowadays, in every case in thyroid, even though they metastasis to the next or some other place, they did. So I think I love that one. And another thing is, through the oral cavity. But nowadays, young women's very small size one, just the one lobectomy they want. So through the lips in outside the nose scar. So through the lips, I do that one. So, but that procedure is just 5 years ago introduced. And there is one advantage is small numbers, especially 20 or 30s young women. And they don't want in sky in outside. And with that procedure is very good. So I recommend that one, even the BABA procedures. It's great.
So my next question was about the techniques of BABA operations, but I think you spoke about it, right? Okay, so can it be used also when the cancer reoccur?
Record that, and as I told you, low risk or high risk patient we did after the operation. In all the cancer patients, they experienced the recurrent cancer. It's awful, and very, in the lifelong, they worry about the recurrence of thyroid cancer. It's the same inside the cancer, but that is the reason why we differentiate the low risk and high risk patient. In low risk, they have low chance of thyroid cancer recurred, but in high risk patients, it's very easy to find the recurrent metastasis to lymph node and some lungs, pulmonary metastasis, sometimes bones. So depend on the types of thyroid cancer, is quite a difference. So my recommendation depend what is the type of thyroid cancer and what is depend on what type of operation you have the choice.
Okay.
Yeah, sure.
So it's up to the patient.
Yeah, sure.
So what are the possible complications of BABA surgery?
Yeah, actually BABA, I think I cannot find any complications. But when we did the operations, the bleedings, sometimes about 5 millimeters we did. And using the robotic systems is complication is not so many, just a few number, and it's very easy to differentiate the nerve to the vessels. So I think even though in unexperienced surgeons, they can do that in the BABA procedure.
It's very safe.
Very safe. But one disadvantage is expensive one.
It's expensive.
Yeah, sure. So in endoscopy surgery, half of the price we did. So nowadays the cost of the using the robotic systems, maybe I think $10,000 US dollars.
Wow.
But endoscopy is half of that.
Okay.
But in using the robotic system, the insurance company sponsored by government, they don't pay for that. So you have to pay by yourself.
It's not covered by insurance.
Sure.
Okay. So after the operation, is there any rehabilitation that should be followed?
Yeah, as you know that I'm not sure it's quite good is comparing that, because when I use the endoscopy or robotic systems, we use that carbon dioxide
Yes.
to make a working space. And as you know that the cholecystectomy or appendectomy, they use that abdominal surgery is the endoscopy or some robotics.
Yes.
That is the reason why we use that endoscopy or laparoscopy. Using the carbon dioxide, they cannot reduce the pain, and back to the normal life is very quiet, and they reduce the complication. The same inside of the surgery. So when I did the BABA or some other robotic systems, and using that carbon dioxide, the quality of life, and after the operation, the back to the normal is very easy. So I recommend that one. And I think lastly, I told you that this one, you understand everything. And in Korea, all the things, endoscopy, updated procedures we did. And in the worldwide, even though in United States or in Japan or some other European countries, they don't have. But in Korea, you can enjoy the side of the surgery, every kind of things. Especially my hospital, you can do that on just a visit and have enjoyed treat to the side of disease.
All right.
You understand me?
Yes, that was very perfect. Thank you, Dr. Yoon, for your clarifications. Today, we learned many things about thyroid cancer, and the doctor explained in detail everything related to this serious cancer, such as symptoms and how it can be diagnosed and treated. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.